Chopping It Up with the Doc. I'm Dr. Custis. Tonight we have a very special guest. During the past few weeks, I've always talked about, things like eating right, deficiencies, and, especially, things that are going to help you, especially during this time when we're suffering from, lots of virus, triple threat, the pandemics, coronavirus, flus, all these different things that are going on, not to mention just your overall general health. Today, I have a doctor, Dr. Leslie Matthews. Basically, this gentleman has been doing a lot of research on vitamin D therapy and vitamin D deficiency. He's had a lot of publications. He's been doing a lot of research, especially with critically ill patients. He did his training down at Morehouse Medical College, and he's been a full professor in the surgical department for quite a while. So tonight I just want to introduce you to him and have him talk to us about vitamin D deficiency, what you can do to pretty much avoid it. And if you happen to be vitamin deficient, what you can do to actually correct it. So once again, welcome, Dr. Matthews. What's going on?
Okay, thanks for having me on your show.
My pleasure. So you've been doing some work with vitamin D deficiency.
Yes, about 20 years worth of work, research.
Wow. It's funny. I would tell people, because I'm on the East Coast, I would tell people, I said, you know what? In this particular region, I guess it's above latitude or longitude 42 or something.
Above the equator. Yeah.
Yeah. We expect people to all be vitamin deficient because we just don't get the proper sun exposure that the rest of the world does. I guess if I live closer to the equator in Africa, they don't have issues with vitamin D, but over here,
yes, they do. Actually, one of the most deficient countries on the planet is Dubai,
really?
UAE, Abu Dhabi. They're a wealthy country, about 1 million citizens of the country, and most people are expatriates, so like 3 to 4 million people that are not from there. But they have some of the worst vitamin D deficiencies because they wear the long hijabs, and it's so hot out there, they're never outdoors. Actually, their vitamin D deficiency is so bad, most of the women have trouble doing childbirth, and most of the men get diabetes in their country by the age of 35. So it's not healthcare access because they all have healthcare insurance, and so they can go to the hospital. Then it's such a wealthy country. I think they get like $1 million a year, those million citizens, to spend or splurge on. So they're not broke, so it's not access. It's like, I say it's technology. We all live indoors, air-conditioned environments. Sunscreen blocks 98% of vitamin D production. And even in African countries, Kenya and on the equator, they're vitamin D deficient. So it's a worldwide problem. Half of the world's population is vitamin D deficient. There are 8 billion people on the planet, 4 billion are vitamin D deficient. That's why the coronavirus was able to spread like wildfire around the world. Most people are vitamin D deficient.
Really? Can you tell us a little bit about that? How does that work?
Okay, first of all, vitamin D is not a vitamin, it's a hormone. It was discovered 100 years ago. So they had vitamin A, vitamin B, and vitamin C, and they just named the next substance vitamin D. So it's just within the last 25 years that we noticed that vitamin D is a hormone. Through receptor research, there are vitamin D receptors on every cell and tissue in your body, your heart, your brain, your lung, your kidneys, your skin, your colon, small intestines, large intestines. So what it does is, as a hormone, vitamin D controls 3,000 out of 30,000 genes in the human body. So we have 30,000 genes that determine our height, our intelligence, our eye color. So 3,000 out of 30,000 genes, that's 10% of your DNA. So that makes vitamin D singly, or hormone D singly, the most important chemical in your whole entire human body. And one among the things that it does is it strengthens your immune system. It upregulates the number of T cells. So, for example, if I get coronavirus, I have 1,000 white blood cells to fight the coronavirus. The coronavirus will overwhelm my body. So what vitamin D does, it upregulates the amount of white blood cells from 1,000 to 100,000. So then I can fight the virus off. So that's what it does. So you cannot have a strong immune system being vitamin D deficient.
Wow, that's interesting. It's funny you said it's a hormone. I mean, going through our training, we see how, vitamin D is converted to the active form inside the body. And, it's funny, we always were taught that it's a fat soluble vitamin.
Yes, it is.
You get it from drinking milk and ice cream and all those things, and some fruits and vegetables, but the biggest producer, like you said, is the sun itself. And it's funny, I never thought about that. I always thought that those countries closest to the equator would be fine, but it makes sense that because their bodies are so covered majority of the time because it's so hot, and they have to live just as much time as we do indoors, even when they have the sunshine.
Because air conditioning is everywhere now, and then they use sunscreen also.
Oh my goodness! But I mean, the sunscreen is supposed to be important because it
blocks 98% of vitamin D production. So we made a compromise with the dermatologist: go outside 15 minutes and then put the sunscreen on, because you have to worry about skin cancers, skin burns, and sunburns, and all that too.
All right, so it's important for people to go out and get sun every day. I mean, that's really the key. So vitamin D is really free because the skin is the biggest producer of it.
Right.
So how do we, now I saw some things that you were using it for critically ill patients in intensive care. How did you manage? How does that work for those patients that are really, really ill with vitamin D? Because I know we were. Go ahead.
Okay, well, remember that we don't make vitamin D inside. So you're in an ICU. I call them the dark dungeons.
Yes.
And so windows block 98% of vitamin D production. So just looking out a window, even though the sun is striking your skin, you're not making any vitamin D. So then the research came out in the Annals of Internal Medicine. A study showed that when you go to the hospital, regardless of the cause, whether it's for a heart attack, stroke, cancer, coronavirus, traumatic brain injury, gunshot wound, your vitamin D level drops 50% within 24 hours of being admitted to the hospital. So,
is that standard 50%? 50%
yes, standard
across the board, whether you're in the hospital. What about when you're not in the hospital?
So if you go in, your vitamin D level was 30. 24 hours later, it's going to be 15.
Wow.
And then certain medications drop your vitamin D levels also, such as steroids, HIV medications. So it can drop it up to 80% if you're taking steroids or HIV medications plus the 24-hour time frame.
Does this also include people at home? If they're, let's say, bad on really cold days, people tend to stay indoors. They're not really getting any sun exposure. So their vitamin, it doesn't.
Most Americans are vitamin D deficient. Probably 70% of all Americans are vitamin D deficient. 97% of African Americans are vitamin D deficient. Because reason they're vitamin D deficient because melanin is good at protecting you from the harmful rays of the sun, but it also blocks the vitamin D production by 98%.
Okay, the melanin
people, melanin, darker skinned people.
Wow.
So we have to stay in the sun 3 to 10 times longer than the average Caucasian to make the same amount of vitamin D.
Wow. So we actually suffer from being minorities. We suffer from vitamin D deficiency even more readily than the rest of the world.
Correct.
Oh my goodness. Now, what I was getting to is the people that are in the house during the cold months. Now, going into the hospital, you say in one day your vitamin D levels drop by half.
Yes, correct.
Are they experiencing that same kind of effect being in the house in the cold months here?
Well, your vitamin D, if you're just at home and you're okay health, your vitamin D level drops 30% throughout the winter months because you can't make vitamin D in the late fall and in the winter. We only make vitamin D from late March through early October because we need the sun at a 90-degree angle. So if you're in the southern hemisphere below the equator right now, you can make vitamin D. So we have opposite seasons. So when we get back into our summers, they're winter in the southern hemisphere, so they won't be able to make vitamin D.
So even going out for a walk in January or February doesn't really help too much?
No, you're just getting sunburned because you have you have UVA and UVB. So it's the UVB sun rays that make vitamin D. And like I said, they're only out when the sun is at a 90-degree angle from late March through early October in the northern hemisphere.
Wow. So it's good to go south in the winter.
Yeah.
Oh, man. So now, I've noticed a lot of people when you check their vitamin D levels, I rarely see anyone who's within the normal range.
Yeah.
And we're always start them on just a basic regimen of vitamin D replacement therapy.
Mm-hmm.
Now, you're going to tell me, I'm not sure now after speaking with you, is like, okay, have we been doing that properly? Because, even though they may be taking the vitamin D
mm-hmm.
for an indefinite period of time, their levels never seem to come up to within the normal range. So are we just spinning our wheels, or what are we not doing right?
Okay, well, first thing, being in ICU, so basically I'm dealing with the critically ill, people near death on the ventilator, traumatic brain injuries, guts hanging out, and all kind of things. So I had to be more aggressive in getting these people vitamin D level up. So when I first started my research, they thought I was totally insane, so I was using the 50,000 IUs, and we were giving it to them every day for like a week or so.
Wow.
Because remember, like I said, your vitamin D level drops 50% in the first 24 hours, and then it continuously declined. So when we started originally checking patients in ICU vitamin D levels, we had some of them as low as 0, 2, 4. And the federal government says your level should be 30. Our research shows you should be above 40. At 30, you just start seeing a slight decrease in mortality rate or deaths. So for vitamin D levels less than 18, your risk of death or mortality rate goes up 30% from all causes. That's regardless of whether you had a heart attack, stroke, coronavirus, traumatic brain injury, multiple gunshot wounds, or a fall from height. So having a patient in the hospital with a vitamin D level less than 18 nanograms per milliliter, when I can correct that with something I can go to Walmart and buy for $15, why shouldn't I correct the vitamin D levels? I like low mortality rate.
You know what? If anybody's listening, that they should tune in right there. Less than 18, you're looking at a third of the people are going to pass away,
Yep.
if they have any kind of real medical issues, or especially
Yes.
acute problem. So now vitamin D, just a standard dose, or should I just tell the people to double or triple up on the dose? It's over the counter vitamin D pretty much.
Mm-hmm.
So someone that's listening to us today say, you know what, I need to go get some vitamin D, but I believe it's, 20, it comes to 25 micrograms.
Yeah, you have up to 250 micrograms milligrams that you can buy over the counter, which is like 5,000 IUs. So
Okay.
the average adult needs anywhere between 2 to 10,000 IUs. And so it's about 30 different things that affect your vitamin D level and how fast you can correct it. Like darker skinned people are going to require more vitamin D than a light skinned person. Obese people are going to require more vitamin D because their vitamin D is stored in their fat cells.
Mm-hmm.
A person with liver and kidney disease can't fully make vitamin D because it goes through the skin and it goes to the liver and goes to the kidney with the 125 hydroxyl groups. So if I have liver cirrhosis of the liver or a renal disease requiring dialysis, I'm going to need more vitamin D than a regular person. If I live in the Middle East and I wear a hijab or I have long clothes, I'm going to need more vitamin D. Or if I've had multiple skin grafts, people that have skin grafts cannot make vitamin D. Or if I'm an elderly person over age 70, I can only make 25% of the vitamin D that a younger person can make. So there are about 30 different causes and stuff. I've done it so long, I can sit there and calculate in my head, just look at how much they're going to need. So it's not one dose fit all because it's the concentration that you need to get to and not the dosage per se. So if I give two people 5,000 IUs, one person's vitamin D level may go up to 15 from 10. Another person's level might stay at 10. So it's based on all those different factors on how much you need.
And when do you become vitamin D toxic?
That's a good question. That is very rare. Only time I've seen vitamin D toxicity is when people get mislabeled dosages. Like they may tell you it's 150 milligrams and it may be 1,000 milligrams. And so vitamin D toxicity is very hard to get. So that's all they talked about in medical school, but it's the vitamin D deficiency that'll kill you. Vitamin D toxicity can cause problems such as nausea, vomiting, abdominal pain, kidney stones, coma, death. But that is so rare. I've never had a patient get vitamin D toxic, but 90-something% of my patients were vitamin D deficient.
Wow. And you're giving pretty much the highest doses you can in intensive care, and they're not getting toxic. So a layman who goes to the pharmacy and buys a bottle of vitamin D and starts to take it on a regular basis, they could feel pretty safe that, their body's going to just get rid of the excess, and, they can continue to take it, bringing their levels up, which would ultimately make their, protect them, so to speak. It's very protective.
Yeah.
Wow. Now, those are the tablets, and vitamin D is fairly inexpensive.
It is.
You can't be in the sun. Now, you said you could go out in the sun for 15 minutes before
putting the sunscreen on.
Without putting the sunscreen on, and that should be pretty safe. If you can get the dermatologist to say, yeah, that's okay.
Oh, they're fine with that. That's the agreement we made with the dermatologist. So that was done in conjunction with the dermatologist.
So go out in the sun, get your sun, but then put the sunscreen on.
Yeah.
I guess it only takes 15 minutes to absorb enough sunlight to produce your vitamin D. That's it.
You can make up to 20,000 IUs with 20 minutes of exposure.
Wow. So so the people are out there sunbathing, they don't even really need to be out there that long, except,
No.
Wow, that's awesome. And, it's free, vitamin D is actually free. If you get the sun, you don't have to pay for it. The, any other protective effects for vitamin D?
Any what?
Any other prevention that can go along with making certain your vitamin D, your vitamin D is covered?
Okay, well, we can get into signs and symptoms of vitamin D deficiency. So you can get hair loss if you're vitamin D deficient. You can have insomnia, not being able to sleep at night. You can have fatigue, brain fog, lack of focus. You can have joint pain, muscle pain, multiple cramps, and so depression. So you can get a lot of frequent upper respiratory tract infections, sinus infections, and so it affects your entire immune system. And then actually is also good for cancer surveillance.
You probably just described half of the population of the country.
Well, 70% of us are vitamin D deficient.
See, everybody has all, but can you imagine, even just hair loss in general, it's like, wow, vitamin D, that would cure probably a lot of people's hair loss. Your vitamin D is fine. Depression, I talk about mental health every week. That's amazing that, vitamin D deficiencies can cause that, especially, since we've had this long lockdown from from COVID, we're seeing, an emergence of even more, mental health issues, depression, anxieties, people are dramatic. You're just seeing a lot of issues. And I'm wondering, vitamin D testing is not part of the standard panel in medicine. It's one of those things that they say is, not medically necessary. Now, today we're finding that, perhaps it is medically necessary and could be the answer to a lot of problems, as opposed to, SSRIs or,
it can. Yeah, actually, the Department of Veteran Affairs just released a study. They found out veterans that had normal vitamin D level had fewer suicide attempts.
Wow.
Actually, 22 veterans a day commit suicide.
Yes.
And so by getting their vitamin D levels up, they had fewer attempts in the group that they supplemented with vitamin D.
So the people that are actually, because if you're here on this side of the country, you're basically, I haven't, like I said, I've never met one person that whose vitamin D levels were within the normal range.
You're not going to meet many.
Yeah.
If you meet one, play the lotto.
Wow, there you go. Thank you. And veterans, their health care is so sporadic, so to speak. I know, just thinking about them, like, wow, how would they how are their vitamin D levels normal as opposed to anyone else. That's an interesting study. What's their source of vitamin D?
No, their vitamin D levels are low too. They did a study where they supplemented with vitamin D. Yeah, they gave them supplements. Other group they gave placebos to.
Okay,
so all of them were low initially.
So the Veterans Affairs actually conducted that study as well. That is a very interesting study. Reading about it, I've been replacing vitamin D for a long time for people. And I never quite understood, I guess the benefits of it until you really, came on and talked about just the heightened immune response, and with that, I know that there was some upward play with COVID, for reimbursement purposes, so to speak, but if the world knows that, hey, we have this bad virus out here, all right, let's get people on vitamin D. I'm wondering, how many lives we could have saved with just a simple, tablet a day or 2 tablets a day.
We would not have 1.1 million people dead. Definitely would not have that many deaths. Actually, it would have made a difference. I tried to get this information to the appropriate people in Washington, D.C. They took it personally, but they didn't inform the public about it. I'll just leave it at that.
It's amazing. It's when you have information to share, it's a shame that you run into the obstacles.
Yeah.
Where it gets from you to them, but then it's not dispersed amongst the people that'll benefit. That's, I've heard so many people say that's bad medicine. That's bad medicine. And I'm sitting there watching. I said, you have 1,000,001 drugs available. I mean, millions of drugs. I mean, where the heck did they come up with the one that they decided to use? Methotrexate?
Yep, they use many different drugs.
That's like, where'd you come up with that? It's like they're just pulling a rabbit out of their hat. Like, let's try this one and tell the world that this is going to, an anti-rheumatic medication. When you're telling them, say, you're doing the research in critical care medicine. Now, is that part of the protocol now in all intensive care units?
No, it was in my ICU. It's still anything in medicine. If you go back and look at the history of medicine, anything in medicine that's even 100% true, it takes an average of about 13 years for it to become the standard of care. When Joseph Worcester said wash your hands, he almost got laughed out of medicine. People going into fields, plowing and playing with their cows and going to deliver babies. These women are dying from sepsis. So they thought he was insane when he said just wash your hands.
Your mortality rate, you said, dropped by how much when you started using the vitamin D?
50%.
50% drop.
It's documented. Yeah, we've published papers on it. We went from 11% down to 3-4% in trauma. People that were shot, stabbed, cut, beat up, falling out the sky, everything and stuff. And so we very seldom had deaths. Actually, during my entire time at Grady, it was at 12 years. We did not have a single lawsuit or malpractice suit. In trauma, you get a malpractice suit usually every 3,000 cases. We went over 20,000 cases. Not that my residents were perfect, but we were getting patients out of the hospital faster. So they had fewer heart attacks, fewer strokes, fewer falls at the bed, fewer bed sores, fewer pneumonias, wound infections and stuff. And so before I got to Morehouse, they had over $30 million in malpractice lawsuits. And so after I got there over the next 12 years, we had 0 malpractice lawsuits.
Wow.
Over a 12-year period.
And that's, what, if I had seen one of your papers, working in the hospitals, working in intensive care, everybody would have been on vitamin D. It would have just been part of the routine admission procedure. They put them on vitamin D. People have said, why? I said, because it reduces mortality. Look at this paper. Look at this paper. Look at this paper. And we are in a profession where you see one, do one, teach one. I mean, the thing is that, more people need to know about the benefits of vitamin D. That's just that. I mean, those kind of numbers are just almost unheard of. And, we'll push things that don't matter.
Mm-hmm.
I mean, we get a hold of a new drug and we prescribe it to everyone, thinking that's going to be the holy grail. But here's something that's been around since the beginning of time.
Yeah.
Okay, from the beginning of time, you're saying that, hey, by bringing your levels up, I'm going to heighten your immune response. I tell people all the time, I said, you know what? COVID's not something, we need to protect ourselves against it, but there are so many other things like influenza virus and pneumonia that have caused more deaths than you can imagine.
We cut out pneumonia deaths too by we cut the incidence of ventilator-associated pneumonia from 80% down to 20% in our patients that are on the ventilators.
Yeah, I mean, just by what you're telling me, I basically already I gathered that already. I mean, just heightening the T cell response, your body can just do what it's supposed to do and prevent infection. I mean, wounds and I mean, so many people out here are suffering. Suffering. I mean, I tell people, so you can go to the hospital for one thing and come out of the hospital and or never come out and your family, well, what happened? He just went in, because his leg was broken or this happened, but nothing related to pneumonia. I tell people, I said, there are more causes. Pneumonia is pretty much one of the primary causes of death.
Yeah, it is.
In the hospital, and I mean, wow. I mean, talk about lawsuit. People like, did you give my dad vitamin D? Did you give my mom vitamin D?
Well, actually, when I started vitamin D research, I got laughed out of a room in a department meeting. They thought I was crazy.
You know how many people, when you think of things that work, how many people will actually look at you, and you've seen that, and say that's not good medicine.
Yeah.
Which is just as bad as being laughed at. So, I mean, how's that not good medicine? Look at my numbers. Numbers never lie to you. Numbers is pretty much the only exact thing that we have. And other people not to follow suit. But it sounds like your hospital has adopted that practice.
Well, since I'm retired, they're not used to much either.
Oh no, you're retired.
Yeah.
It's a shame that people have to retire.
Yeah.
And because I look at the profession and you look at it and you think when people retire, there's a slight decline in, I guess the standards of care. I mean,
there's a big decline. You losing, I had 32 years of experience, so you lose all that experience.
I'm being kind. I'm being kind, but I mean, the push is for more commercialized medicine.
Yeah.
Commercialized medicine. More outliers, more assistants. I mean, people can go to the doctor for months and months and not see an actual physician. They'll see a physician assistant or a nurse practitioner, which was never the case, prior. But between reimbursement problems, I mean, you're forced to see so many people just to keep the doors open. And it was never like that before, and they claim that they're making it better. There's a colleague of mine. He's going to come on the show. He refuses to do the computerized medical record.
Yeah,
he says it takes too much time.
It does.
It's cheaper for him to take less money from Medicare and have them criticize him than get the electronic medical record, and waste time with all the input. He says, you spend all day seeing patients, then you have to spend half the night inputting all the data into the computer.
Oh, that's true. Prior to retiring, I spent 2 to 4 hours every night doing electronic medical records. It's after working 18, 20 hours a days. Yeah. And I didn't get home to midnight most nights, even when I wasn't on call.
Yeah, it's, my wife, we were just talking about that today. She was always talking about, she said, when you were at work, you were gone all the time.
Yeah, you are.
You're gone all the time, because I think the conversation came up with one of her friends. They were going through some marital and actually getting a divorce because, he was never there to help raise the children. I said, but son, he's got to work. Somebody's got to work.
Yeah.
I mean, you can't, you got to live somewhere. You got to eat. You got to pay some bills. you know. So, you know, he was an engineer. He was working a lot. He worked a lot of hours. But the thing is that, you know, somebody's got to go and work. I mean, I know it's a full-time job taking care of the house, but somebody actually has to go out and do things. And, you know, the outside world and the inside world inside your home, they don't mix well together. They kind of clash.
No, I worked 80 to 100 hours for 32 years, 80 to 100 hours every week.
Yeah. I used to teach people. I remember a 3-year period where I don't even remember seeing the sunlight.
Yeah, I went my whole career didn't see the sunlight. That's when I had to take vitamin D supplements.
you get into work before the sun comes up. You don't leave till it's dark. You know, dark. Then you fight your way home. You know, and the next thing you're back at it again, and it's constant. It's, you know, I tell people it's 7 days a week.
Yes.
When you get a day off, you can't do anything but sleep.
That's it.
You know, so I mean, I said it's a lifestyle. I said, you know, I'm sure, you know, it doesn't. People don't mean for things to happen that way. It's a good job. It's a great profession, but it's very demanding. It's not only demanding on you, but demanding on the families.
Yeah.
You know, and you know, people really. I mean, we suffer as a result of it. But you know, those hours, and he's like, you know, I can't give. And I said the same way. I'm not giving 4 additional hours.
Yeah.
To paperwork, you know, that's 4 hours I can spend at home. You know, I'm not going to go at home and do it.
In surgery, we were forced to because they would suspend your operating privileges if you didn't keep up with the medical records on a daily basis. Yes,
everywhere you go. If you don't keep up with your records, you can't admit patients to the hospital. You can't operate. You know, they find a way to force you to do it.
Yeah.
You know, and it's really not fair because that's time that you're not compensated for.
Yep.
You know, and it's time that it costs you more on the other end of your life.
Well, you don't have a life. You don't have a life doing electronic medical records.
Yeah, you have. I mean, it's hard to have a life at all with this profession. You know, and I tell people, I said, you know, it's not what it seems.
No.
You know, I tell people, I said, you know, it looks like you make, you know, your well-being and your lifestyle is much better because they say you're in a higher income bracket. I say, when you have a private practice, it really only looks that way. You know
what the average pay for a CEO of a hospital is in the United States?
Well, they're all $7
million.
Yeah. You know, I'm like, I'm paying them. Yeah. You know, and I've never seen a single CEO stay past 5, 6 o'clock.
Me 4 o'clock.
You know, they're gone. You know,
gone the whole weekend.
Yeah, gone all weekend, holidays. You know, they may stay once a month for a big meeting.
Yeah.
You know, you see them, but for the most part, they make a lot of money, and those monies are based on reimbursements to the institution. You know, and so I mean, they could hire 3 docs like yourself.
Mm-hmm.
You know, to cut your time spent by 2/3. You know, to improve your quality of life, but they've never, you know, thought like that and cut their own salary. Football players, which is funny, will cut their salaries to get a better player on their team.
Win a Super Bowl. Yes.
But in our profession, a lot of professions, you know, I mean, they'll lay off 32% of their workforce.
Yep.
You know, and then,
with the nurses all the time.
Oh man, you know, they were striking up here in New York.
Yeah, I saw that.
They were striking up here in New York. And I said, wow. You know, it was funny. Years ago, they asked me, you know, I was in a meeting. They said, you know, what will it take for people to listen to us? I said, well, the only thing we can do is break the law. And that's just not all across the country. Just decide not to show up for work.
Yeah, that's true.
You know,
otherwise they don't really care. You know, so doctors need to union themselves because they're ripping doctors off big time.
Yeah, I mean, it's horrible. And, you know, I found that it's against the federal law for doctors to do that. You're actually breaking the law. There's no union for physicians.
Well, if all doctors strike, you can't arrest everybody.
That's true, you know, but I mean, they'll find one guy. They'll make one guy an example. But I told them, I said, the only way you're going to make it better is you have to do something drastic. The nurses decided, I mean, the nurses just walked out of the hospital. So they were not working anymore, you know, and listen, I know, and you know, the hospitals don't function without
No.
them.
Nope.
You know, and you know, it doesn't function without us either.
No.
You know, because we tell them exactly what has to happen. You know, and it's a team. But I simply watch other people benefit on the work from others. You know, not just benefit, but really benefit. I mean, I'm like, what does a CEO do? What does a COO do? Or the actuary? You know, what do you? I mean, you're just accountants.
Yep, bean counters, I call them.
Like, what do you guys really do? You sit there and are we making money or are we losing? You know, very simple. Okay, so you know, but they don't take. Yeah, that's across the board. They just really don't take care of the people that work for them, and that's pretty sad.
Yeah,
you know?
And then they give themselves bonuses at the end of the year after on top of the $11 million.
You know, I told people this a long time ago. You know, it's by law that they have to publish their salaries once a year in the local papers. You know, it's the same way in Atlanta too. You know, one day you open it up and read the papers, and you see all the CEOs in the state and their annual salaries. You know, and I remember then, I'm talking about 20 years ago, the salaries were between 5 and 7. Now you're telling me up around 11 million.
11 million. Yeah.
And I worked at a hospital where they had the highest paid CEO in the country. It was a woman.
Wow.
You know, and she was making 2 and 3 times what the average was, you know, across the board. This was not that long ago. And I'm like, wow, everybody was complaining, how is she making all of this money and the hospital is such disarray? I said, well, she gets hers first. That's why. So what are you doing these days? I mean, you're retired now.
Yes. Well, actually, I do a lot of stuff with vitamin D. I do a lot of podcasts, TV talks, interviews, newspaper, magazines. So I hired a PR agency. So I'm trying to get the message out worldwide, global. We're working on a documentary with my PR agency on vitamin D and things that went on during the pandemic that could have been done better, things they didn't tell the public about, how the media and World Health Organization, CDC, FDA, and all those groups colluded, you know, to keep the public ignorant. And so
why would they do that? That doesn't make any sense.
They have agenda. Then Big Pharma makes a lot of money. Pfizer made over $100 billion last year off the vaccine. It was a record profit year for them.
Yeah.
And so actually, I remember Big Pharmacy came to me when my research started getting out, and they said, well, if you put this research out, you're going to hit us in the pocket. You're going to mess with our bottom line. I said, I'm not trying to mess with your bottom line. I'm trying to get people healthy and keep free will. I said, if you keep charging more and more, you're going to price yourself at the market. Federal government's going to have to put a cap on how much you can charge for your medications. I said, so I'm actually working for you in terms of trying to keep a free will market. So actually, Big Pharma knows who I am.
Wow. You know how, you know, it's amazing, you know, when you deal with Big Pharma and their bottom line is always more important, you know, than patients, you know. And, I always sit there and I say, you know, the answer when it comes to us in our profession is never always.
Yeah.
All right. But, you know, I've just never had an encounter where that was just not the bottom line, you know, with that conversation. And that's shameful. I say, you have a medication that can actually cure an illness. You know, how many cures have we come up with in medicine in the last 100 years? I mean, actual cures, not treatments, you know, not anything preventive or palliative, but actual, we can actually get rid of it. You know, and here you have something that comes up and you can actually cure it. You know, why is it that you are not making it available to everyone? Okay. And more importantly, why isn't the federal government stepping in when you have such horrible problems from this illness, step right in and say, you know what, we're going to administer this medication to everybody with this problem. This will no longer be a problem for people. You know, I think the first time I've actually seen it was with the vaccine, but the federal government, they still managed to make $100 billion with the vaccine. And that was basically probably because of public outcry. The federal government felt as though they had to do something, so we were able to just go anywhere and get the vaccine for free, but I'm sure they were able to just bill the government and the government paid the bill, which is, it's amazing how that works, and people tell me, I said, I always told people, I said, you know what, the world is going to age. Okay. You cannot control the cost of healthcare when you're in the middle of an aging population. All right. If you want to control the cost of healthcare, put a cap on the cost of healthcare. The people that are raising the bar, your medications, medication should not cost as much as it does. It costs $1,000 here, but if I can go to another country and get the medication for $1, where's the other $999 going?
Well, the federal government or Medicare and Medicaid or Centers for Medicaid and Medicare, they cannot negotiate with drug companies. They have to pay retail price. So if you allowed Medicare and Medicaid to negotiate lower prices, we can save billions of dollars. That's one of the ways we can save money. You have to pay retail price like everybody else.
But that,
a law against that.
But why is that? Why are they not able to negotiate a price?
Because Congress passed a law that gave them that ability. Just like you can't sue a big pharma for even if you die from the vaccines, they have indemnity against that.
They're indemnified. And that's just a lobbyist. That's that middle guy going in and lobbying to protect them. And, that's
protected by lobbyists.
It's but they're doing it at the expense of people.
They don't care about that.
But the thing I tell people all the time, and you've seen it, I've seen the most powerful, healthiest, wealthiest, poorest people get crumbled and reduced to not even a fraction of themselves as a result of an illness. Okay. And we've seen people that are at the top of the world one day, get sick, lose their benefits, and end up worse than people that have Medicaid their entire life.
Yeah, they do.
And they can't get any help whatsoever.
A lot of them die prematurely.
I said, wow, you can work your entire life, get diagnosed with a problem before you hit retirement age, lose all your benefits from all the time you work, and you die prematurely because you can't get health care.
Yeah, correct.
And the people that can help will sit there and just watch and nothing. I mean, and nobody says anything. Nobody can do anything. And people, being on the front line, I have to look at people and say, I don't know. There's nothing I can do. And next thing you get a piece of paper from their attorney. Like, oh, thank you. Wow. I said, we've done everything possible that could be done, within the guidelines to help your loved ones. But when you have that kind of situation, because this vitamin D, man, that really bothers me. Vitamin D is so cheap.
Yeah, it's powerful.
It doesn't cost, it costs less than a pack of cigarettes.
Yes, it does.
Okay. To put in perspective for all the people that are suffering from medical issues as a result of smoking, vitamin D costs less than a pack of cigarettes. How many people, you can just imagine that we can think of that had pneumonic issues or cancers or anything else that could have been on vitamin D supplementation, and it could have extended their life and even improved their life. It's like, that's wow. What programs are you working on now that are coming up that I hope more people see?
Well, like I said, with this documentary that we're working on, we're trying to make sure that goes global, worldwide, to get global exposure with the documentary.
Yeah, because people need to know about vitamin D. This is horrible. I get a lot of, I'm starting, my listeners and viewers it's picking up every week. I'm hoping that they share this, all the people that are listening, just share what you're hearing tonight. Not only implement it for yourselves, but share it with your family. You want to protect yourself from COVID. You want to protect yourself from the flu. You want to protect yourself from pneumonias. It's not antibiotics or, any kind. It's something simple like a vitamin D. And it's very inexpensive. And you can take 1 or 2 tablets. You can have your doctors check your levels. You go in the office when they check my levels and have them check it. Every 3 months is probably sufficient to see if it's coming up. If it's not coming up, you can just double the dose and, keep on doubling until you reach at least, you need to be at least 30. Bet over 40, but at least 30.
Yeah, other things I've done with vitamin D, I actually have a patent on vitamin D with other ingredients used to treat concussions and traumatic brain injuries.
Okay.
So that patent was awarded in 2019. It's very hard to get a patent. You basically have to write a PhD dissertation in order to get a patent. And so I got my patent in 18 months. And normally it takes more than 2 years. And they wrote back that there was a novel treatment for concussions and traumatic brain injury. Also with vitamin D, I figured out how to reverse congestive heart failure. Patients with ejection fractures are like 15 to 20%. We were able to get them up to 40, 45% using high dose vitamin D.
Wow. And with the number of receptors, like you say, there are vitamin D receptors everywhere. Yes. So basically the vitamin D is just stepping in and help those heart cells heal up.
Yeah, it's like a cheap ionotrope. It's like calcium. So, yeah, it makes the heart pump better.
Wow.
So, yeah, congestive heart failure is nothing but a weak pump. So you make the pump better. And then these people, quality of lives will change. Most of these people couldn't walk outdoors on oxygen. Most of them now walking up flights of stairs or exercising, doing all kind of things.
Listen, I lost my father to congestive heart failure.
Yeah.
So I understand. Yeah. What they produce? With ICDs, let's put them on an electronic cardio defibrillator, and I've worked with them for a long time, but I've never actually seen an ICD work.
Yeah.
Until I actually saw it on my own father.
Mm-hmm.
And I had no idea that's what it did.
Yeah.
And if you've never seen one work, actually it's like it's no different than in a cardiac code when you hear them say clear.
Yeah.
I'm sitting there like, I'm thinking that it did something quiet and benign, but it wasn't. It was just the complete opposite of quiet and benign. And that's, they would spend thousands of dollars to put a defibrillator in that did nothing but tell you if there was an arrhythmia, and if it was a malignant arrhythmia, it would discharge. Whereas something like you're telling me right now, vitamin D, which costs next to nothing, right, can actually heal heart cells, and actually, as a positive ionotrope, people, is something that makes the heart beat better.
Yes.
And make the heart contract. That's, that alone is, that's mind-boggling in medicine, And the thing is that when you see things like this, I know you've published a lot of things, but I guess what do you want to call it? The holy grail of publications would be the New England Journal.
I'm published in the New England Journal of Medicine, but on a trauma subject though.
Right, on trauma. Otherwise you don't hear about it. JAMA, some of these, the American College of Cardiologists, some of these magazines, but the people need to hear this, just the physicians alone. It needs to get around the country for people to hear about the benefits of vitamin D. And I'm almost certain that you have the paperwork,
I've published articles on it.
Here you go. And it just requires people to read it, and I'm going to ask if, when you get a chance to send me an email with, those papers, so that I can not only read them myself, but also share them with people. That's important, just a countless number of people that would have lived, I'm not saying they would still be here or they'll live to their 100 years old, but the mortality will never change. But morbidity, the quality of life that people have.
Yeah.
I mean, you're talking, that's worth its weight in gold. The vitamin D, for people that they're no longer, you're telling them now that you can actually get up and move around. You can actually do this. You can, you can live. You're not short of breath. You're not sitting at home on oxygen. You don't have the serious edema that occurs with it. You're not on 200 milligrams of Lasix twice a day, running back and forth to the toilet all day. So that's wow. And I hope people are hearing this and understand that, you don't need a physician to get a prescription for vitamin D. That, just by hearing the conversation today, that most people where we're located, or even in the world, are vitamin D deficient. Okay, vitamin D deficient. And if you want to protect yourself from viruses, you want to protect yourself, even if you just want to get better quickly with minimal to no complications as a result of viruses, these colds or this virus or whatever's out here nowadays, the flu, it would benefit you to take the vitamin D. I'm always telling people to take these antioxidants and things like that. I need to think about the vitamin D, and now understanding the benefits of it a little bit more, it's part of it's part of my
vitamin D is an antioxidant and an anti-inflammatory agent, so it works on both areas.
Unbelievable. It just keeps a lot of bad stuff away.
Yes, it does.
Unbelievable, man, unbelievable. But listen, because we're running into the end of the program. Take a couple of minutes and just tell the world who you are and how they can reach out and talk to you. If they have any questions about vitamin D, your email, phone number, whatever you want to share.
Okay. All right. My name is Leslie Ray Matthews. I'm originally from Indianola, Mississippi, hometown of B.B. King. The youngest of 12 kids. My dad was an elementary school principal and a Baptist minister. My mom was a homemaker. Went to University of Mississippi Medical School, graduated cum laude in chemistry. Did my critical care trauma fellowship at Mayo Clinic, Rochester, Minnesota, the #1 ranked healthcare research center on the planet. Was at Grady about 14 years. I'm retired since December 31st, 2019. My email address is lematthews, MATTHEWS 91 @gmail.com. So that's how you can reach me. And then if you want to read further articles for the general public, you can Google my name and pull up a lot of my research on the just Google. And or if they need to reach me through my agency for talks and stuff, that's Ebony at ebonymediagroup.com. It's EBONY at ebonymediagroup.com.
I'm going to also ask that whenever you have programs or when you get to go out and speak to people about, the benefits of vitamin D, please plug us in so that, listen, it's always good to have a friendly face out there.
Okay. Thank you.
You got it. So once again, everyone, I have Dr. Matthews here, came to us today to talk about vitamin D therapy and the importance of it. We want to thank him for coming on and sharing his time with us. And, basically for now, that will basically conclude this show. And God bless everyone. You guys take care, and we'll be in touch again in another week. All right, everyone. Good night.
Thank you.